Dr. Lisa, you're always saying I need to get to know my girl parts.
We're gonna tell you even more than you think you already know today about those girl parts. Keep your vagina very, very healthy. The vagina has a nice, healthy balance. It cleans itself, self-cleaning oven.
Why is that so important? And how can that help my sex life?
Girl parts, self-cleaning ovens, the vagina. This is all you, Dr. Lisa.
Well, and you too, you need to know about this
I know
as well.
I do, that's why I'm all ears.
Okay, the vagina definitely falls under things you don't want to know about your body, but you absolutely should. And again, you should too, if you want to keep your woman healthy. Yes, and you should take notes. You should take notes at home. So, Jamie, I'm going to start by answering your question and encourage all women out there to get to know their girl parts. The International Journal of Sexual Health reports women who hold a positive view of their genitals or their girl parts are more likely to orgasm, ladies. So that's why it's huge. That's why it's huge too, because you want to make sure your lady's happy, right? And
well,
that's what that indicates.
Whatever we need to do to increase the number of orgasms, we will do it. Trust me.
Yeah, it is.
Whatever you tell us,
so you got to get your lady friend to look down there at her girl parts, because only 1 in 4 women is looking down there and knows what's going on down there. And whether you hold a mirror or you get up to a big mirror on the wall with your legs apart, look and examine.
You might want to lock the door.
Yes, you want to do it. You want to do it in private.
Just checking out my girl parts.
That's right. Getting friendly with your girl parts. And what I really, really, really encourage and recommend is, obviously this is much easier to do for your doctor and you if there's a little landscaping going on around there.
So what I'm learning here is that the vagina itself is a self-cleaning oven.
Right.
But it's not a self-gardener.
No.
Okay.
It may need some tending in more ways than one.
Okay.
So the more landscaping, the more you can see the skin, because you want to look and evaluate the skin, because a lot of times if you find something, because you want to look for skin changes, moles, anything going on down there that isn't usual or normal for you. And color changes are actually normal, women, so don't be afraid of those. That's a natural part of aging, that it actually can get darker. If you see something that is cauliflower shaped, raised, painless, and just kind of appears, it could be a genital wart. It's that cauliflower shape to it. And a lot of times it will just change the edge of the labia a little bit, so they can be very discreet. Your doctor, your gynecologist looks for these when they're down there looking around and you don't know what they're doing. It's not usually red. It's usually the same color as your skin, unless you've rubbed it against something and it's gotten a little irritated. The other thing, and this, again, is usually painless. Now, something that may have pain with it, may have a little tingling, or what we call a prodromal syndrome, is herpes. And they usually start off as blisters, and then they pop, and then they form ulcerations. You may not see these or feel these at all, and what you really have to remember is that you can pass on herpes without any of these lesions appearing. Some people don't have these lesions, or sometimes they're inside by your cervix or your vagina. And then last but not least, what I get a lot of women coming in who are familiar with their girl parts is ingrown hairs. So if you just find a painless bump, looks kind of like a pimple down there, which you can also get in that area, then this is just an ingrown hair. Warm water, exfoliation. Remember to beautify your Betty, pretty your petunia, make it all lovely, pamper it, look for signs of aging. Because you want aesthetics down there. If you're not interested in down there, who else is going to be interested? Okay?
Last comment here, and this is really important. You may know your spouse's private parts just as well as they do. So if you notice a change in your spouse's vagina or penis, you need to bring that up, because, again, you may be the only one who noticed this new bump.
Well, I can't tell you how many women actually find bumps on their breasts. We tell women to do, and I don't advocate that their partners all do their breast self-exams, because they can be a little distracted. But a lot of times I will have their partners come in and say, my husband or my boyfriend noticed this, and it's real. So, I encourage your partner to know your body just as well as you.
Dr. Lisa, thank you so much.
Yeah.